Hey there and welcome. It is good to have you with me tonight. We are going to talk about eye anatomy from the perspective of an iridologist. We go into the structure of the eye a little bit differently, and the structure is all the same, but we understand it a little bit differently than what you get in high school biology, or maybe even in overall courses like nursing or things like that. So this is going to be an excerpt of the actual information that I teach in as a part of dynamic iridology. By way of introduction, my name is Judith Cobb, and I am a level 3 IPA certified iridologist. I was chosen as instructor of the year by IPA in 2022 and as iridologist of the year in 2024. So those are both pretty impressive, pretty prestigious appointments from the International Iridology Practitioners Association. Again, through IPA, I am a level 3 certified instructor. Last time I checked, there were only 10 of us in the world, so that's pretty elite. And it's really my life focus is teaching holistic wellness and iridology to holistic health practitioners, as well as working with it in my clinic. I'm also a nutrition professional associated with the Canadian Association of Holistic Nutrition Professionals and the Canadian Association of Natural Nutritional Practitioners. And I'm also a master herbalist associated with the Alberta Herbalist Association. As we launch into this evening, we are going to be doing this preparatory to introducing you to the Dynamic Iridology Assessment System, which is the only live online fully mentored course for nutritionists, herbalists, naturopaths, registered nurses, functional medicine, functional nutrition practitioners who want to work more efficiently and more effectively while really enhancing client care beyond what they thought was possible. The goal here is to reduce your unpaid overtime that you probably now spend developing client programs. And we want you to stop overwhelming your clients with programs that they can't possibly do. And we want you to create programs that will increase client compliance, success, and long-term retention. Using the dynamic iridology assessment system, you can achieve all of those goals. Because the goal of dynamic iridology is to teach you constitutional iridology and how to use it confidently so that you can easily integrate what you already know about nutrition and herbology, whatever your other modalities are, to confidently create doable client programs in your paid client sessions. All right, let's dive in. Almost. If you love what you hear here, if you love what you hear here today, I want you to grab this URL. This is how you get to speak with me privately, personally, about the dynamic iridology course to determine if it is a good fit for you and for the kind of practice you have or you want to have. So I'll post this again towards the end of our time together. This is how you schedule a Zoom meeting with me to talk about your goals, where you want to head, and again, assess whether iridology is what you want to do. All right, so first thing we need to know when we're looking at eye anatomy is how to tell a left eye from a right eye. When you're working with a person, of course, that's not a problem because if they're sitting right in front of you, you know their rights and their lefts. However, if you're working off a photograph, often the facial features will be cut off of that. And so you need to know right off the top that you can distinguish a left eye from a right eye just by looking at it. Well, sometimes you need to get out a ruler and measure. So with that, what we need to know is the pupil is never exactly in the center of the iris. It is slightly off center. And specifically, it will always be off center towards the nose, which means the narrow side of the iris names the eye. So if the narrow side is to the right of the pupil, it is a right eye. If it's to the left of the pupil, it's a left eye. That's really important because as we do iridology, what we see in the right eye and what we see in the left eye are different. Similar to reflexology, if you're familiar with that, what you have in the right foot is slightly different from what you have in the left foot because it makes a perfect little map of a body. The eyes do the same thing. What we have in the iris makes a perfect little map of the body. So let's pop into looking at an eyeball. So when we're looking at the eyeball, we've got a few things here that we want to pay attention to. We're going to review all of this pretty quickly. First off, we have the sclera, which is the outer coating of most of the eye. It's the outer layer, very tough, very membranous, and it helps the eyeball to hold its shape. There is a science of health assessment that uses the white of the eye. It's called sclerology. And in dynamic iridology, we do some introductory level sclerology. At the front of the eye, the sclera becomes clear. This is the cornea. And so the sclera and the cornea are continuous with one another. And of course, the cornea needs to be clear to let light through. Then we have the anterior chamber that is filled with aqueous humor. We have the lens, which is embedded just sort of behind the iris. We're going to take a deep look at the iris. And then we have the optic nerve coming out the back. Notice the sclera actually continues around the optic nerve. That optic nerve is really important, right? If the optic nerve is messed up, your vision gets messed up. So that's what we want to focus on here. And really, we're going to be looking at the iris itself. We're flipping that image just on its end because the next piece we're going to look at is this area in cross section. Okay, so hopefully this makes sense. This was something that took me about 30 years to figure out what this next diagram was about. A little slow on the draw there, but when I got it, it was like, oh, now I get it. So that side of the iris is right here. So we have the pupil here. This is the front of the iris. This is the part that faces out. This is the part that has the color. If you've got blue eyes, there's very little pigment in here. If you've got brown eyes, you've got a lot of pigment here. This is the back of the iris. This is pointing into, I'm just going to back up a couple of images here. The back of the iris is pointing into this area of the eyeball. So it's pointing, or it's against, it's facing into the posterior chamber. Okay. So does that make sense? Do you understand what you're looking at here? That this is the front surface. So this is the iris in cross section. One side of the iris, just one side. We've got the pupil here. We would have the white of the eye out here. We've got what we look at when we're looking at the iris. We're seeing this layer, and we don't see this layer because it's facing into the eyeball. All right. So with that, we've got lots of muscles and nerves and blood vessels and things in this layer. This layer is called the stroma. Just like it says right here, this is the stroma. And it's made up of all kinds of different kinds of tissues. The posterior membrane is also known as the dilator muscle. That's going to be very important. That's what literally dilates the pupil. This is the sphincter muscle. This is what contracts or constricts the pupil down. These two layers of cells here, and it is precisely 2 layers. This posterior epithelium is very precise, 2 layers thick. Dark black, dark brown cells here, very light sensitive. When these cells are stimulated by light or by a lack of light, they send the message to the brain that sends the message back to the eye that tells the sphincter muscle to constrict if there's bright light, or tells the dilator muscle to constrict if it is dim light. So as we look at this then, we want to pay attention when we're looking at an iris to what we call shading. When we look at this, you can see that there's this image of this blue eye in the upper left of your screen. There's a darker edge to it, a dark gray edge to this iris. And even within the body of the iris, there are bits of gray. Okay, so when we've got gray, this is called shading. And this is either a lack of fiber structure. So we have less fiber, thinner fiber towards the outer edge of this eye, or we have less fiber in the body of the iris. Sometimes when we're looking at an iris, and the blue eye is just the easiest one to practice this on. Sometimes the fibers look like they're very thick and very raised, like they're sitting way on top of the iris. And so this is, technically it falls under the category of shading, but it's not really shading, of course, because it's not shaded. It is sitting high on the surface of the eye, like we see in the diagram in the lower right-hand corner of your screen. And everything we're looking at here is genetic, right? If this is sitting high on the surface of the eye, that's genetic. And it tells us that the part of the body that correlates to this part of the eye is much more prone to inflammation, to acid imbalance, to pain, to congestion. When we have an area that has less fiber, so it's darker, it's shaded, it's gray, or it might even be black, that is telling us there's less resilience here. It's going to take a lot more energy, a lot more food and nutrient going into that area for that area to function with any degree of goodness. And it also tells us that whatever areas are gray, they aren't very good at getting rid of garbage because they just don't have the resilience or the strength. So it takes more nutrients to help them do their job, but it's going to take a lot of energy to help them also get rid of waste product. Does that make sense? Does that make sense? Let me know in the chat box if that's making sense for you. When we look at this image in the upper right of your screen, this beautiful light brownish kind of an eye, again, you've got lots of areas in here that are dark. This is shading. This is separation between fibers. So we are looking down into the depths of the eye, maybe even separated right back to that posterior epithelium. And we're seeing the dark in there, which again means less resilient, less resilient. On a true brown eye, this is not a true brown eye. This one in the center of the bottom is a true brown eye. We can still see some separations in the fiber and see some dark in there. This is not the same thing. This is a pigment sitting on the surface of the eye, as opposed to a separation that is letting us look deep into the iris tissue. Does that make sense? Let me know in the chat box if that makes sense. We talked about those sphincter muscles and the dilator muscle, right? So the sphincter muscle hugs the pupil rather, all the way around. So when a muscle contracts, the muscle fibers ratchet in. So you can probably visualize that if you've got these fibers that go around like this, and they start ratcheting in to contract, that's going to make the pupil smaller. Now, you've got your anatomy and physiology under your belt. So remember back to when you studied muscle physiology. There is nothing that actually pulls those fibers apart. Once they're ratcheted in, they're in. You know that if you've ever had a Charlie horse or a cramp in your foot in the middle of the night, right? And so there has to be something that will pull it apart when the time is right. That would be the dilator muscle. So what we've got here is the dilator muscle anchors into the sclera, and it also anchors to the outer edge of the sphincter muscle. So when that sphincter muscle is contracting and constricting the pupil, it is going to stretch out the fibers of the dilator muscle. When the dilator muscle is being stimulated, when it's dim light and that dilator muscle is being told, open up the pupil, the dilator muscle ratchets in, which means it compresses into a smaller area. But because the outer edge is anchored to the sclera and that edge is not going anywhere, it pulls on this edge of the sphincter muscle. And that is what makes the sphincter muscle open. So there's always, to affect a movement in the body, there are always opposing muscles, right? You know that you've got the muscle, your bicep, that lets you do this, and the tricep that does this. The bicep cannot push the arm out. It can only pull the arm in. The tricep can only stretch the arm out. So the sphincter muscle can only make the pupil get smaller, and its opposing muscle is the dilator muscle, which can only make the pupil get larger. Make sense? Are we good? The iris itself has approximately 28,000 nerve endings. We don't know what they all do yet. We don't know why they are all there. Some of those nerve endings seem to end blindly in the stroma of the eye, and we just haven't figured out how to figure out what they do. So in this image, you can see clearly that sphincter muscle. Can you see that there is an edge here where we go from whatever color you're perceiving this to be? On my computer, it's like a real pale, mauvey, purpley color. We get to the edge and suddenly we have colors that are more blue, almost more, more blue. Good way of describing it. This area here that we see, this slightly more lavender, purpley, pinky color, that is exactly the constrictor muscle. Exactly and precisely, right? So when we see that, when we can see the edge of that as clearly as we do, it tells us there's a layer of fiber missing in this part of the iris. And whenever we have a layer of fiber missing, we have reduced reactivity, reduced resiliency. We know that all of the organs that have their reflex points in this area are going to have a slightly tougher go of it. Okay. Can you see that constrictor muscle? Can you see that ring right there? If you can, drop the comment in the chat box so that I know that you are seeing it. And then we need to look at blood flow. This is a really elemental diagram. It's not completely accurate. It's just to give you the idea of how the blood flow is in the iris. Those strands in the eye that look like fibers or look like threads are actually capillaries that are coated with collagen. And because they are capillaries, there is an arterial flow and a venous flow. And you already know that arterial flow moves away from the heart. Venous flow moves back towards the heart, right? And so what that means in the eye is that, let's come back here. We're going to use this ring as a dividing line. This is properly called the collarette. So this is our collarette in this diagram. And what we see here is the circulation, the blood flow will go from the outer edge of the iris towards the collarette, and then it was going to turn around and come back out. So we've got arterial flow towards the collarette, venous flow away from the collarette, right? Now, it's not hairpin turns quite this tight. This is, again, just a representation of. In the area inside that collarette, the arterial flow starts at the pupil's edge and goes toward the collarette. The venous flow goes from the collarette back to the pupil's edge. So the arterial flow in the iris is always going towards the collarette. The venous flow is always going away. Does that make sense? Are we good? So as we look at this, let's do a little bit of a case history here. Here we have a woman who's in her mid-30s. She's had fertility issues, and she has insulin resistance, PCOS. She's been trying to get pregnant for the last couple of years. She's had one conception that ended in miscarriage. Now, as we look at her eyes, as this beautiful brown eye, and this is simply a blow up of the full image. So half of the eye is blown up on the right of your screen. Can you see that inside these openings, there's a lot of little black bits? That's the kind of shading we are talking about here when we talk about looking into the depth of the eye. So we've got layers of these fibers that we call trabeculae, the capillaries coated with collagen. We call them trabeculae. They are layered up, several layers of them, very fine, right? So several layers in the iris. And where they've separated is where we see the shading, and we're looking down into the depths of the eye. So this particular eye suggests there may be a personal or family history of the MTHFR defect. Now, is MTHFR something you're familiar with? And there are specific markings in here that do suggest that that is her predisposition. And the fact that she has PCOS also adds to that, that there's a high likelihood that she has MTHFR. Now, I don't get to diagnose that because I'm not a medical doctor. And we can't even get the MTHFR test here where I live anymore because so many people have it, they just now assume that most people do. But knowing that she likely has MTHFR, she is a Filipino, right? And we know that Asians have a much higher incidence of it than Caucasians even. So there's a good chance she's got it. Having MTHFR makes fertility that much more difficult. The color of her eyes also suggests liver inefficiencies, where her liver may not want to do its job all the way. And of course, if the liver is not happy, that can mess up hormones and lots of other things that can make fertility even more challenging. We've also got what we call contraction furrows, which are these rings coming around the edge of her eye. They look like wrinkles in her eyeball. These are contraction furrows. And these don't necessarily mean she will have a fertility issue, but they teach us about her chemistry, about how she metabolizes certain nutrients. And that gives us information that says, oh, that could increase the challenge of getting pregnant and staying pregnant. And I just need to remember, did I say, yes, I did. I needed to make sure I hit record on this. We see this little bit of cloudiness towards the outer edge of her iris. That suggests that she likely has a bit of a personal history of her liver enzymes not being quite where they need to be, and of carbohydrate metabolism, which of course, if she's got problems with carb metabolism because the liver is not happy, that increases the risk of insulin resistance. That also increases the risk of messing up her lipid panel, which again can have an impact on fertility. So when we see that clouding at the edge of the eye, at the edge of the iris rather, we need to be asking about carb cravings, right? Now, she was very aware by the time she came to me, she had been working on cleaning up her diet for a couple of months, and it was doing great wonders for her. By getting rid of those refined carbs, she had actually lost about 10 pounds in 2 months, which is quite amazing. She had probably another 15 or 20 to go to get down to target weight, to a weight where we would feel like she had a better chance of keeping her metabolism balanced, keeping her blood sugars balanced so that she could carry a pregnancy. We don't need to talk about every single marker we see in the eye. There's a lot of information in this eye on a lot of different levels, whether it's what we see inside the collarette. The collarette itself contains a lot of information. Each of these other markings gives us more information about different things, but they're not all important to her goal of becoming pregnant. So as an iridologist, our job with our clients is not to teach them about every little thing we see and what they can do about it. That is incredibly overwhelming, and it's not necessary. And I'll tell you why in just a moment. Our job is to look at her eyes and gather the information from her eyes that give us more information about her concerns and her current health situation so that we can ask the right questions and make the right recommendations. Now, why would it not be important to look at each and every single marking we see? Well, it wouldn't be important because she may already be doing a lot of things really right. And as I said, she had done a great job of doing some really good diet cleanup in the 2 months before she came to see me. And so that makes some of these markings irrelevant, as in, I don't need to flesh the story out with this, right? I can just simply say, congrats on doing a great job with your diet. Here's a little more shifting we'd like to do there, right? Your eyes give me this kind of information about your liver or your ovaries or your hormones overall. Here are some things that we can do, maybe some supplements that we can do that will support that. So we never want to overload our client with so much information that they go into freeze mode, because then they're not going to take any action at all, and they will not get the results they're looking for, right? So we want to focus on what they feel is important. And if there's other markings in the eyes that we feel are important, we can kind of weave that in without even really talking about them too much, right? If we feel it's the right thing to do. All right, so do you want to learn more iridology? That would be the question. Do you want to learn? Now, I had originally planned out my teaching year so that I would get most of the summer off. But I've had a lot of students, a lot of prospective students come to me. They missed the February start date and they don't want to wait till September. So I've decided to take less time off this summer, and there will be a new cohort starting on May 15th. So if you have got that college level anatomy and physiology, maybe you're a registered nurse or a lab tech or an EMT or a massage therapist, maybe you had to do a separate A&P course as a part of a herbal program. If you've got that and you've got the proof of it, because we're going to need that at some point in time, then I invite you to use that link that I posted in the webinar chat, the tinyurl.com/dynamic-iridology, and schedule a time to chat with me about where you're at, what your goals are, how you would like to have iridology be a part of your business, and let's see if this is a good fit for you at this point in time. I limit my classes to no more than 10 students because I want to make sure that we have adequate time to answer your questions and get you so rock solid that by the time you finish the course and are ready to sit for the IPA certification exam, you know your stuff. You know it cold, and you're going to pass that test first time around. So if you're interested in learning more, and if you've got that A&P, use that link. The course, I will tell you, meets once each week for 20 lessons. We're going to take 1 week off. I am taking a vacation this summer. We'll take 1 week off, but we'll have 20 classes. They will be from 5 till 7:30 p.m. on, I should remember what day of the week that is going to be, on Thursdays. So hopefully that is perfect for you. Here's that link one more time. tinyurl.com/dynamic-iridology. And again, this is the only live, fully mentored course to prepare you not just to be an amazingly good iridologist, a well-trained, very confident, very competent iridologist, but to also help you do better and more for your clients while actually not overloading them at all, not overwhelming them. So important that we don't overwhelm our clients. This is Joyce Lee. She is a clinical aromatherapist. Before she enrolled in my course, she had just barely enrolled. She said, "I'm so excited to have this opportunity to learn new and updated iridology under Judith's expertise and her many years of experience. As a clinical aromatherapist, herbalist, and nutritional consultant, I decided to take an iridology course through another institute. I thought it would be an excellent service to add to my practice. Unfortunately, I quickly realized that I wasn't going to get the knowledge, confidence, and results I wanted, so decided to drop it altogether. After finding you, Judith, I'm really looking forward to getting started." After she was just 3 weeks in on a 20-week course, and we hadn't even done mentoring yet because the mentoring doesn't start till the end of the course. I'm learning so much from this course. So far, it has been a real eye-opener. I had no idea how little I actually knew about iridology. No wonder it was never working for me. There are so many pieces to each individual's personal puzzle. The challenge is putting it all together and remembering all the little details. I love what I'm learning and appreciate your thorough teaching technique. And then after she graduated, this is what she said. Judith is a wonderful instructor. She presents the material in this course in a concise, organized way. Every aspect of this iridology course is covered in detail. She clearly answers every question asked, no matter how trivial the student may think it is. Judith structures the classes in a way that makes them incredibly interesting. Clarification is clearly established through her instruction, discussion, and student participation. Upon completion of Judith's course, I feel very confident in my abilities and excited to offer iridology services to my clients. This course is an incredible value, highly recommended. Just giving you a little introduction as to what the course includes. Again, 20 classes that are 2.25 to 2.5 hours long. Each class is recorded for playback on demand. So if you have to miss a lesson for whatever reason, or if you want to go back and review, it's going to be there for you. We have group mentoring tutorials held twice each month. These sessions are for you to bring questions and cases for us to discuss and to get you extra support if you need it, whether it's about business development or an eye case you're working with. Anything that is iridology related is fair game in these office hours sessions. And sometimes, again, we talk about whatever you need us to talk about there. These sessions are open to you even after you've completed the course and even if you're certified. We have a student and alumni social media group. It's a private group for between class and after course support. So again, if we're between office hours, maybe you've graduated from the course so you don't have the weekly classes anymore, but you need some support with something, you can post it. You can come back to office hours, absolutely, or you can post it in our social media group. We call it a community now. We've just changed the name, and you're welcome there to get whatever support you feel you need. You have a 225-page digital textbook. All of the materials that we use that any IPA certified instructor uses in teaching iridology must be approved by the education committee at the International Iridology Practitioners Association. So you know that the material has been vetted. It's not just my opinion, it's been approved. So that's pretty cool. It's digital, so you can download it. You can leave it digital if you want, whatever works for you. You also get digitally 45 pages of study notes. We call them the cheat sheets because they distill everything in the course down to charts and tables. Very succinct, a really great quick reference guide. IPA certification mentoring. This is important as well. Most teachers charge extra to mentor you for certification. I don't. I include that in your tuition. IPA has a very specific protocol for the mentoring, and I include it for any of my students who want to certify. It is there for the taking. It includes a lot of one-on-one time and a lot of case study work with me literally marking your work and making sure you're totally on track. Next course again starts on May 15th and runs 5 till 7:30 p.m. Mountain Daylight Time. I forgot the daylight in there. And again, registration's open now. So if you're thinking, yeah, I want to get started now, you'd be finished early October, but you want to get it done now, then book a call. Let's talk. Let's talk. And that, my friends, is everything for tonight. And we didn't have a lot of interaction in the chat group, in the webinar chat here on this one, but that's okay. That's okay. For anyone who watches this on the replay, please remember to like it, subscribe to my channel, drop a comment, and share it with a friend. Let's get this information about iridology out there to more holistic health professionals. All righty. Are there any remaining questions? Anything else that you would like to have answered for the time being? I'll give you just a few seconds. If you're typing in a question, just use that raise hand icon so I know to wait for you. And if I don't see the hand icon go up, we will call it good for tonight. Okay, so that's looking like we're good for tonight. Thank you so much for being with me. I look forward to seeing you again, and I look forward to meeting you on an insight call. Take care and have a good evening. Bye for now.